lesions do not affect the dermis. Therefore, it is possible to treat xanthelasma and successfully remove them without leaving any scarring. That is true. However, as I said, we've done a number of consequences unless subsequent important infections occur. This is a readout from the webpage Why and How Certain Xanthelasma Treatments Do Not Leave Any Scars. We have made a number of videos about this subject, and then if you watch them you'll understand, but in this particular video what we're going to do, we're going to actually read this webpage and provide you with some comments, some commentary in order for it to be easier for you to understand. So, why and how certain xanthelasma treatments do not leave scars. Xanthelasma is a cholesterol formation that builds between the dermis and the epidermis. No matter how big or deep the xanthelasma, these lesions do not affect the dermis. Therefore, it is possible to treat xanthelasma and successfully remove them without leaving any scarring. Custom peels are the least expensive and most convenient solution to treat and successfully remove the xanthelasma without any scarring. Now, the most likely way to get a scar is by doing a surgical excision. You'll also see we've got lots of information on our website about the different ways to remove your xanthelasma, but the most likely that's going to leave you a scar is surgical excision. But the funny thing is that the least expensive and the least likely option to leave your scar is actually cosmetic peels, either TCA or our xanthe remover, which is a glycolic acid product. But the funny thing, once again I want to repeat it, is that the least likely option that is going to remove your xanthelasma without leaving you scarring are the cheapest, as to say TCA or other cosmetic peels for xanthelasma removal. And the reason is quite difficult for me to explain, but it's just from empirical data, especially from what we've got after selling so many xanthe removers that had 0 reported scars. So we're quite confident that this is the least the option that gives you the least chances of getting a scar. So that's very, very important. So the two main precautions. Now the other thing that we're going to read right now is that basically when you go to a cosmetic clinic, in order to minimize the risks of scarring, is that they've got to make sure that they don't actually cause too much damage to the dermis. As we've seen here and in previous videos, it is possible because of the anatomy of xanthelasma. The two main precautions to be taken in order to not to cause any scarring after this type of dermatological ablations are: the dermis has to be left unaffected by the treatment. No infection has to develop after the treatment. Both are very important, and then remember that even if you get lasers removal, whatever type of removal, including voltaic arcane removal, if you get an infection after that, then you're quite likely to get a scar. So it's not, the other point that I'd like to make here is that it's not as if there's any guarantee that anyone who's reputable can provide you that they're not going to leave a scar. However, you can minimize that likelihood. So far, 0 people have reported a single scar with our treatment. Thanks to modern medical equipment which make this possible to ablate the tissue with a high degree of precision, not possible with a manual scalpel, which is very, very important, because if you use a scalpel, then you're very likely to cause damage to the dermis. This high level of ablation precision allows the operator to leave the dermis intact, This is why laser, hyfrecator and other instruments are very effective when removing xanthelasma without generally leaving any scarring. However, in some cases it is not advisable to try and remove the whole lesion within one session unless xanthelasma are still shallow. If xanthelasma have grown particularly deeply into the skin, it is not advisable to remove them within one session, even by using sophisticated medical equipment, because this will very likely cause scarring. Therefore, in case you are trying to remove a thick xanthelasma, it is not advisable to do it within one session, because the treatment could be too aggressive and cause damage to the dermis. Now, this has been an article which I've actually written myself in 2013, so a long time ago, after a few years of experience in removing this xanthelasma, also mainly using I should say, electrical arcing, using my hands, or the xanth remover by doing it remotely by sending the product out. We found that even when especially when using electrical arcing, when you're actually trying to remove the whole xanthelasma, still, if you do a good job, there is no scars left after the treatment. That's very important for me to emphasize. And normally when you're removing xanthelasma, you see that you have to go really deep into the skin. That doesn't mean that you're going really deep into the dermis anyway, because the xanthelasma, as we've seen in the anatomy of xanthelasma, it pushes down the dermis anyway. Using surgery, it is a few days after laser treatment, laser removal, actually left a hole in there. So, and this is quite common. Now, but this is what we're seeing here. This is actually the result of excision. The patient on the right side of the picture inevitably developed a scar on the eyes because the excision is far too deep. This is the problem about using scalpels, is that you're not able to control the ablation as well. This is done with the clear intention of removing the xanthelasma within one session. This was not advisable, and the patient should have undergone at least a couple of sessions instead. Now, this text should actually be changed, because basically when you're doing a surgical excision, you don't want to actually do 2 sessions. As you've got to go through a surgical procedures twice. Why would you want to do it? But the point is, whatever you do with surgery, basically you've actually using the option which are going to the option which has got the most likely outcome of leaving a clear scar. And this image here, it gives you an idea what sort of scars you're going to be left with. The first session would be used in order to get rid of the main bulk of the xanthelasma, followed by at least 6 weeks healing. The 6 weeks healing would have allowed the natural skin reconstruction necessary to treat the patient with the laser again, and leaving the dermis intact, therefore leaving no scars. Pushing for xanthelasma removal within one session is common practice in private healthcare cosmetic surgery. This is simply because the quotations provided are generally for complete xanthelasma removal, and the less number of treatments, the higher the margins. Now, this is about laser xanthelasma removal more than excision. Okay. Due to modern specialized equipment, the dermatologist has all the instrumentation. Now, I've got to stop here a second, because again, this has been written in 2013, and now by law within certainly the UK, this is not a treatment that only dermatologists can do. Basically, there's, as far as I know, in most of the councils, at the moment I'm actually in Lincolnshire Council area, there's not even need for a license to actually do it. So it depends on where you are. You may not even need a license, and let alone being a dermatologist, in order to remove xanthelasma. So that's very important. Now, it's not something that only doctors can do. Other people can do as well without any restriction, depending on the council, and that is due to the due to the legislation of the local council, but as long as you've got a permit, it's not going to be a problem, and you don't need to be a doctor in order to get the permit, unless you're using lasers only in certain councils. So the dermatologist has all the instrumentation required in order to remove the xanthelasma, leaving the dermis unaffected and therefore minimizing the risk of developing scars. However, when the xanthelasma are very thick, it is always advisable, as shown in the above picture, to undergo multiple sessions instead of rushing to remove the xanthelasma within one session. When the dermatologist proceeds to remove xanthelasma, he will be able to selectively target the cholesterol deposits, leaving the dermis intact, provided that the xanthelasma is not too thick. As a consequence, unless subsequent important infections occur before healing, the likelihood of scarring are very low. That is true. However, as I said, we've done a number of procedures without leaving any scars using electrical arcing, so it is actually possible to remove xanthelasma without leaving any scars, even within one session, provided that you know what you're doing. The same level of precision is possible with specialized medical equipment, and now also possible using the customized xanth remover. A bit of parenthesis, now it's not customized anymore, it's a standard product. If you, as 2019, before 2019 anyway, is already a standard product thanks to its formulation with glycolic acid and vitamin A. So if you want to know more about that, then you'll find more videos and more information on xanthelasmaremoval.com. If you apply the xanth remover as directed, it will target exclusively the superficial part of the skin and the xanthelasma, leaving the dermis intact. Additionally, when using the xanth remover, the risks of infections are extremely low, as the xanth remover does not cause an open wound. Now I'd like to stop there a second. When you're using the xanth remover and you try to remove the xanthelasma within one session, you're very likely to actually have left a couple of big holes instead of your xanthelasma. So per xanthelasma that you're removing, very likely you're going to get a couple of holes, one hole. So if you've got one xanthelasma, you put the xanth remover there to dry out. After the scab falls off, you're very likely to see a hole instead of the xanthelasma, and then that hole inside your skin will have to heal by secondary intention. So that's not exactly precise, because this was applying more to TCA. When we wrote this, we were still very likely using TCA, if I remember well. Additionally, when using the xanth remover, the risks of infections are extremely low, as the xanth remover does not cause any open wounds. Consequently, the risks of scarring are even lower by using the xanth remover than any other type of excision. Now, this is exactly true. Even if you use TCA and you buy it cheap on the internet, the likelihood of scarring by using TCA are far, far lower than if you went and paid loads of money for excision of your surgical excision of your xanthelasma. It's to say, to surgically remove your xanthelasma using a scalpel. So a cheap TCA solution can actually do the job far better than a surgeon can do. That's a fact. Please note that although the risk of scarring can be minimized, no treatment to remove xanthelasma can guarantee scar formation after its removal. And that is very true. We're never and will not guarantee any scar-free treatment by any means, because if we did and something went wrong, we have to pay the bill. So it is clearly in our terms and conditions that there's no guarantee that no scars will occur. However, said that, so far, after thousands of products that we sold, treating so many xanthelasma, we had reports of 0 scars, even with, at the very beginning, with the TCA based xanth remover. Read all about the xanth remover. Please note that although the risks of scarring can be minimized, no treatment can remove can guarantee that your xanthelasma will not be removed, as this is repeated, and we're going to actually get this corrected. So thank you very much for watching. Should you have any questions, please get in touch with us.